there is a test for tamoxifen sensitivity. It's a CYP2D6 test, and it really just gauges how well you metabolize a drug called tamoxifen, which is one of the most common and the oldest drugs to treat breast cancer. It is a selective estrogen receptor modulator, a SERM, and basically it just attaches to the estrogen receptor in the breast cancer cell and doesn't allow estrogen to bind to it. So, in fact, 30 years ago, it was actually used as a as a fertility drug, and they realized that it had some impact on breast cancer spreading as well. So it checks for mutations to see if you metabolize at a high rate. That's actually a bad thing. Metabolizing at a high rate means that your body is consuming that medicine before it has a chance to do its job. So this indicates if you have, if tamoxifen is really going to be a good drug for you, or if it's going to be something that's utilized by your body in too quickly of a way. There are other hormonal options that can be used. So this may say, okay, tamoxifen is not the right drug. You need to be on an estradiol or letrozole or Faslodex or any number of the 15 different hormonal drugs that can be provided. So this is a really great tool to help your oncologist make the hormonal decision for you. Another really great test that is just now coming into normal usage in the cancer world is genetic testing like FoundationOne or Caris testing. And this test for every current known mutation that has a drug that can treat it, and this includes drugs that are in clinical trials. This really indicates the future of cancer medicine. So precision medicine, you've heard me talk about that before. This tells us that, okay, on paper, estrogen receptor positive and HER2 negative cancer can look identical across the board, but when you have a mutation that allows the cancer to grow in other ways, it can actually cause treatment to fail pretty quickly. So these mutations are what really makes cancer unpredictable and allows the cancer to metastasize and grow despite what we call standard therapy. So if you have a person who has these mutations, an mTOR mutation or PIK3CA mutation, those are different pathways that cancer can grow even if the estrogen is deprived. So we have a number of drugs that target these pathways and put up another blockade basically to prevent it from growing that way. So this is kind of the future of cancer care and something we look forward to, so people can have a better response to treatment and in some cases make that metastatic cancer a chronic condition. MammaPrint is another similar test. It looks at the activity of 70 different genes and calculates a recurrence risk over a 10-year period. So it's a tool to help people make a decision about whether they should do chemotherapy or not, and also determine if more aggressive therapy should be used to treat early stage breast cancer. It may have a low Oncotype score, for example, and it may say, okay, we don't need to do chemotherapy. If it has a really high chance of recurrence based on the MammaPrint test, then it might be a good idea to come up with big guns now rather than have it come back later. We talked about this last time, the Oncotype test, and this basically determines your cancer sensitivity to chemotherapy. So this says, okay, you don't want to undertreat you, don't want to overtreat you. You've got a really great chance of chemotherapy being a good option for you. So this is something that your doctors can use to make sure that they're not overtreating, undertreating you, or in some cases treating you with the wrong drugs. A lot of these tests are going to be used in concert. I've had every single one of these tests, and it really has been a great guide for me to determine that I'm on the right treatment path. And my almost 3 years of inactive metastatic disease is really a testament to these tests being used to make sure that we're making the right treatment decisions.